Neonates in the NICU experience as many as 17 painful procedures per day. Of these painful procedures, heel sticks are the most common, comprising 61 to 87%. Preterm infants are more sensitive to pain, in part because they lack the neurodevelopment to comfort themselves. Analgesics are rarely given for blood sampling, and few seem to be effective. Painful procedures in neonatal infancy may have short and long-term consequences, from increased blood pressure to neurological outcomes. Short-term consequences include increase in heart rate, decrease in blood oxygen, heart rate variability, and blood pressure fluctuations. Pain in the first few days of life has been shown to magnify the pain response to later stimuli. Here's a timeline of the long-term outcomes of painful NICU procedures. At 40 weeks, early skin breaks were associated with reduced lateral thalamic volume, slower metabolic thalamic growth, and altered white matter microstructure. From 8 to 18 months, more skin breaks predicted lower mental development index. At 3 years, cognitive and motor scores were predicted by thalamic volumetric growth, regardless of sex or gestational age at birth. At 7 years, a greater number of invasive procedures were associated with reduced white matter and lower IQ. At 8 years, more invasive procedures were associated with smaller amygdala and thalamus volumes, related to poorer cognitive, visual motor, and behavioral outcomes. Pain reduction is possible through blood draw reduction. Centec Transcutaneous CO2 monitoring can help. Centec. Care with confidence.